P2P. My job is very easy. I just need to be here and sit here. But it's basically the old fellows who had worked with us. They're gonna guide you guys.
Sure.
So let's start with the introduction. So it looks like more than 10 people are already here. But you want to coordinate the session?
Yes, Dr. Faizan, I will share your PowerPoint. Just give me one moment.
Why not we just take a couple of minutes, other people are joining, and do a quick introduction. So
Okay,
name
sure.
and where are you working?
Okay, sure.
I can start.
Okay.
Hello, everyone. I'm Junaid. I am a second year fellow at Roswell Park, and I have worked with Dr. Anwer since 2018. And I'm happy to be here.
Well, Junaid, thank you for being here. And you may know or maybe not know, I have shared your CV with so many people, before the mentoring and after the mentoring, and of course, with your permission. So thank you for doing that. And so Junaid is now doing a HEMONC fellowship at Roosevelt Park. Who's next?
I can go next. I'm Vijay Hyman. I'm PGY2 resident in internal medicine. I'm going to apply this year in HEMONC fellowship. I'm in St. Michael's Medical Center, New Jersey. And I'm working with Dr. Anwer since 2020. So it's been like 4 years. So, and now I'm happy to at least arrange this session so that it should be helpful for all of us for the fellowship.
I guess I can go next. I'm Mohammed Asher Ali. I am a second year resident in New Jersey, and I'm also working with Dr. Faiz Anwer for more than 4 years, 3 to 4 years, and applying for fellowship this year. Happy to be here.
When you guys say you guys working with me, I just want to correct it. You guys are not working with me. You guys are working with one each other and working with a big group. And the group is called Medical Scholars Forum. So I coordinate, I mentor and guide, but you guys are working and learning from each other. So let's quickly do this round of introduction. I have only 10 slides to share with you, and then I will let you guys chat with each other.
So Zunera, you can go next.
I'm Zunera. I'm a first-year fellow at Roswell Park, and Dr. Faiz Anwer has been my mentor from 2018.
Excellent, great, good to see you. Who is next?
Good evening.
You can
I
go
can
next.
go next.
Okay.
I can go
That's
next.
okay. Sure.
My name is Sabah. I'm working as a hospitalist. I graduated from internal medicine 2021, and from last 2.5 years, I've been working as hospitalist, planning to apply HEMONC this year. And as Dr. Anwer said, I'll say the right thing that I've been finding good research projects from this group from last 2 years, and yeah, happy to coordinate.
Just to make it quick, I can start saying the name so that we can quickly start going. On my screen, Ali Shahbaz is coming next. If you can go ahead and introduce yourself.
Good evening, everyone. My name is Ali Shahbaz Baloch. I'm a third-year resident at Weiss Memorial Hospital. I've been a part of this group since 2020, and I will be starting my fellowship at Stroger Hospital, Cook County this July. Pleased to be part of this.
Thank you so much for coming here. Aslam can go next. So next is Divya.
Good evening, everyone. My name is Divya Solipuram, and I am a second-year resident in Nassau University Medical Center, Long Island. I am going to apply this year, and I've been on this group for last 1 year, and I'm happy to be here.
Welcome, Divya. Next, Hiba, you can go.
Assalamu alaikum. My name is Hiba Narvel. I am a third-year medicine resident at Jacobi. I actually matched into HEMONC this year. I matched at Medical College of Wisconsin. Inshallah, I'll be starting my fellowship this July. I actually joined the group almost after I matched. I learned about Dr. Anwer then, but I'm happy to be here and help and guide whoever I can.
Thank you so much, Hiba. Next is Faiza Kamal.
Assalamu alaikum. So I am a doctor from the UK. I have not in the American medical system just yet, but Dr. Faiz Anwer has been helping myself and my husband with opportunities to do some research, and then once we sort out some visa problems, then I intend to get some clinical experience, hopefully in the US.
Happy to have you. Next, Dr. Karan Nipana, you can go.
Hey everyone, so I'm Karun. I'm currently a third-year medicine resident in Jacobi Medical Center in the Bronx. I'm starting my fellowship at Moffitt coming July, and Dr. Anwar has been a huge support for me since forever. So I'm happy to be here. Happy to answer any questions you guys might have.
Thank you, Karan, for joining. Next, Lucas Fernay. I'm so sorry if I'm pronouncing it wrong.
That's okay, no worries. Hello, I'm a doctor from the UK as well. I'm currently sitting all my steps and getting research experience and building my CV and things like that. And I've only recently learned about Dr. Anwar, so I'm glad to be here. Thank you.
Good to have you. Next, Saad Malik.
Hey, can everybody hear me?
Yes, we can.
Oh, that's awesome. Well, first, wow, it's just amazing to see everybody from all across the world. My name is Saad. I'm one of the cardiology fellows, first year, about to go into second year. I first met Dr. Anwar in like 2017, and it's been quite a lot of years, and it's amazing, absolutely amazing to see where we have come. I have a lot to say, and I'm on a chatty side, but I'll let everybody talk. I applied in cardiology with a lot of HEMONC articles that had a very high impact factor compared to cardiology journals, and that really helped me during my interviews. So I'm really thankful to Dr. Anwar for this journey. He had a huge contribution. And Dr. Anwar, congratulations. This is just amazing to see. I'm amazed.
Well, thank you so much. So when I fail, people go to cardiology, and I'm happy to take that kind of a failure any day. All right. So I think it's 8, 9, 10. I don't want to take too much time. Why not I just try to share my screen and see if I can. Let me go back, share screen.
Sure.
PowerPoint live. Yep, this one. All right, let's see. Preparing the slides. And okay. Not sure if this goes into the presentation mode, but this is just a peer-to-peer. The idea is to hear these guys and what worked for them and what's their advice. I have just few examples of recent people. We met a couple of years ago, and these people were applying. So Abdul Rafi is now a HEMONC fellow in Little Rock, Arkansas. He wanted to do myeloma. He also started working about 5 or 6 years ago before his residency. Zonera is here. Thank you, Zonera, for being here. And she also worked around the same time, and she's now a fellow at the Roosevelt Park. Hamid, I think he said he's going to join us. He had a little bit different track. He was already working as a hospitalist and wanted to pursue HEMONC. He also did MPH publishing, so he's also got successful, and I think he's now ready to graduate. Shirin is in Cleveland. She's doing her HEMONC fellowship at the University Hospital next door to Cleveland Clinic. And so these are just a list of different things which these people have done, and you guys can also do. I know some people are just applying this year. So you'll be applying in June, July, and your interview will be in November. And by December, you actually know where you are going. So it could be as simple as just some case report or case series. It could be image report, letter to the editors, could be a focused review, could be a systematic review, could be a meta-analysis, could be a retrospective review in your own hospital. If you have some focused data, you can analyze that. Sometimes these prospective trials, phase 2 and phase 3, in some centers may be doable, but that typically takes longer time. And I think that will be more appropriate for people who are already in HEMONC and want to pursue a career. And you may be able to do some maybe a month, a 2-month rotation in a basic science lab. I actually did that, and that gave me a little more better perspective and more things to talk about during my interviews. You can also write about common topic or topic of interest in newspapers. Sometimes your own department want to publish few things for patients and families and education material. So you can also work on your own departmental website literature. And quality projects, teaching projects, everything counts. So you need to have a focus. You need to have self-motivation. So you need to be leaders, take your own journey in your own hand. Ask for feedback, show your dedication, work as a group, and develop the skills which are necessary. So this is just a diagram to show that what you need to do to stay motivated. And this is coming to the end. I say that if you just write 3 lines every day, and in 10 days, that's equal to 30 lines, that's equal to almost 3 paragraphs. And in a typical article, there are about 7 to 10 paragraphs. So in a month, you'll be able to write a full length paper, review paper, and educational review paper if you just write 3 lines a day. So read an article and daily, so that will give you more insight, more knowledge, more orientation about the research, just some basic skill building for research, how to use Word, EndNote, literature search, tables, figures, and read some literature. And if you're just reading for 10 minutes in a month, you can actually read a book. And now this should not be your curriculum book. This should not be your medical book. I want you to read more things, because when you write in English, you need to have better, and English is not, most of people here, the English is not our first language. So how are you going to improve if you're not reading literature? So that's why I recommend you read literature. And help your family. Sometimes there are siblings, some there are husband, wife, spouses. They are both in the same field, so work together as a team, help each other, and help people on your team group, and continue to publish. So excellence is a process, and a road to success is a long journey. So it's not an on-off switch. So the message to the people here is, for whatever reason, if you are entering into the fellowship, just remember that that's just the beginning of a new marathon. And if you're not entering into the fellowship this year, you may have to enrich your profile a little bit more. And that failure does not mean it's a true failure. It just tells us that you're probably gonna achieve more, better things, and you are just getting ready for the bigger jump. And so make sure, and you and your family, your health is a priority along this journey, and sky's the limit. And these are just my acknowledgement and thanks to my parents and my teachers. That's it. Thank you. So I will try to see sharing, and then who want to go first? How about Junaid? Do you want to take a couple of minutes and give some word of advice?
Yes, Dr. Anwar, thank you very much. So I think the most of the people in this group who are either fellowship applicants, right? Am I correct?
Yes.
Yeah, so I think
Yes.
when you are applying for the fellowship, of course, like your CV and personal statements are the 2 most important things. Regarding the CVs, in the CV, the most important thing is your research experience. Whether you are, whenever you have, if you have applied for residency before, the most Dr. Anwar has told us, like, if you do 10 clinical rotations, they're going to add like a couple of lines. But if you do 10 publications, they will add like one or two pages to your CV. So publishing and presenting your work is the most important thing that they will ask you in your interviews when you are applying for the fellowship. That's the one thing. Second thing is the teaching. You can also mention about your teaching experience. You teach to medical students when you are during your residency training. So make sure you mention that. And the third thing I want to mention is that during your residency, try to do clinics in hematology and oncology. And that you can also add to your CV and that you can discuss in your interview that I have this experience during my training, and this experience has polished your interest and in the hematology and oncology, and then you can discuss interesting cases and discuss your work. These are the few things that have helped me.
Well, that's great, Junaid. Let's see who wants to go next. How about Zunaira?
Hi, everyone. So I agree with everything that Dr. Junaid have said, that research counts a lot, because when you give interviews, everyone in my all interviews, like I gave around 17 interviews, and I was asked about my research experience. So everyone starts like almost about like, tell me about your research experience. So it's very important that at least because if you have 1 year now to apply, so you must have like 3-4 good research things that you are already either working on, or at least 1-2 papers that you have published, so that you can talk about your projects, because they will be interested in what abstracts, if not complete papers, at least try publishing in ASH, so American Society of Hematology. The deadline will be in August. And for ESCO next year, the deadline will be in February. So if not complete papers, at least try publishing in good, try presenting in good conferences. So it helps a lot. You can add them in your CV, because these abstracts are peer-reviewed abstracts, so they can be added into your CV, and then you can say that I went to this conference, I presented this poster. The conferences also gives you a chance to network and meet other fellows, and many of the attendings are also there, so you can meet them. Other thing I would say is, if you are from a community program, your program does not have a very strong hematology oncology division, then try rotating into a different bigger hospital who have hematology oncology experience. So for example, I was from a community hospital, and my program has a medium-sized oncology program. So I rotated at Northwestern to get more experience of hematology oncology. And also letter of recommendation counts a lot. So try working with different mentors and getting good letter of recommendations, because other than research and your clinical experience, what counts a lot is your letter of recommendation. So I think these things really helped me a lot. Research first thing, letter of recommendations, and then rotating into some program where you can get more oncology experience.
Well, Zunaira, thank you. That's great. I just want to let people know they can ask their particular question in the chat box, and either we will try to address those questions, or we can reply by typing the answer to those. Now, let's see who wants to go first. How about Karun?
Yes, sure, Dr. Anwar. First of all, I want to thank you again for holding this session every year. I've been, I think, getting involved with these sessions since last 2 years or so, and really happy to see a lot of familiar faces here today. I definitely agree with what my previous colleagues said. I mean, they have been my role models and guides. On top of that, what I want to say is the ERAS application had changed a little bit since our application time. Now it allows you to choose geographical preference and also the various kind of settings of the program, urban, rural, that kind of setting. There is two ways to go about it. Again, I don't think there is a objective data or a standardized way to go, but one way to go is just to say that you don't have any geographical preference. And what I told was I chose the programs based on their merits more than based on their location. So I'm happy at any program that I applied to. And the other way to go around is figuring out which programs you really want to end up at and which geographical area those programs are located in, and just mention a specific reason why you want to go in that geographical area particularly. I don't think there is a right or wrong answer per se, but you might want to think about that, approaching it one of those two ways. In terms of letter of recommendation, it's never early to ask for letter of recommendation, even though if you are rotating right now somewhere with a mentor, just ask them right now, and you can ask them to upload later on, but asking it early is always a better idea. The third thing I want to say is try to figure out which programs you really want to end up at. And the way to figure that out is just go to Google and search for these Excel sheets that are used by applicants every year. Those lists have at least some details about the programs, most of the programs, so that you have some idea about the strengths and weaknesses of each of those programs, and you can target those programs specifically, and that makes it more likely for you to get an interview from a program that you really, really desire. And I think that's pretty much all.
Thank you, Karun. That's great. Let's see who wants to go first. How about we hear from the cardiologist?
Hey, Dr. Anwer, thank you very much for the opportunity. Junaid, Karun, and Zanara, it's really great to hear from you guys. Familiar voices from many years ago. I have a bit of a different take on what my colleagues have mentioned. I think they've mentioned great things and they're very successful. I continue to follow their journey, and they have been doing really well. So you might be, sometimes you get intimidated by the research and the amount of work your colleagues have done. But my take is, number one, research is not just a publication. It's a collaboration with different colleagues that you're going to be talking to. So for example, I happened to help some of my family members during this current match. And how it helped was the collaborations that they did ended up revealing their personalities that the people on the other end happen to like, and they really vouch for them for the match. So it's not just a publication, it really is a connection as well. Second thing, when you apply, you get an interview, people ask, do you vouch for these interviewees? And a lot of people request us every year. The way we vouch is the one who we have professionally worked with, work ethic. There is no way of knowing unless you have worked with them, and research is one of the great ways to do that. So that's number one. Second, I can tell you from my personal experience that when I applied for cardiology, 80% of my research was hematology oncology, actually. And my letters, one of the letters were from Dr. Anwer. And of course, he's a hematology oncologist in Cleveland. So I was asked this question directly, that how many publications in JACC do you have? So JACC is one of the finest journals in the world of cardiology. I had maybe one, or it was just submitted at the moment. So I knew what he was asking. The question was, he was trying to know, what's the impact factor of your work? So I said, look, I have XYZ publication in JACC, but I have published this much in hematology oncology, and their impact factor is 7, 10, 12. They were way better than the JACC journal that he was mentioning. So he was very impressed, and he said, oh, really? Then because I said, look, I got the opportunity in hematology oncology. I worked really well. I learned the methodology, and I can apply anywhere now. So that interview ended up there for my own reasons. I am where I am right now. So that's second. And third, I know Karun here, he did really well with his publications and ended up having a green card. And that's, again, based on your scholarly activities. And it's basically vouching at the end of the day. So your mentors basically vouch for you that he has a good work ethic, he has a good potential, and you end up with those things. So this connection building through research and showing your mettle and your dedication, it goes a long way just beyond the publications. Yeah, that's all I have to say for now.
Well, thank you so much. Let's see. I see Amar. Amar, are you here?
Yes, can you guys hear me?
Yep.
Hi, so it's nice to meet you guys. Nice to meet you, Dr. Anwar, after so long. I'm a first year fellow at University of Nebraska this year. I think my story is a little different because I worked as a hospitalist for a few years. So I see a question about someone asking someone who worked as a hospitalist. So I think the biggest thing when you are working as a hospitalist is if you are still involved with someone from oncology, working with them and publishing with them. So I think even if you work a few years, that's not looked down upon and not looked down upon unless you are making use of those years. And as compared to like the previous speaker, my situation was kind of opposite to him. 80% of my research was in cardiology, but I ended up applying in oncology. And it goes on to show that I did put on most of my publications, even in cardiology, on my CV. And in some cases, I did get asked, and I was like, when I was a resident, I wasn't sure what I wanted to do. Some of the research is from pre-residency, but I don't think it made any negative impact. I think it actually helped me. So that's one thing to consider. Otherwise, I don't really have. One of the prior speakers did mention doing rotations. I think that is very helpful for various reasons. It shows your interest in the field. You get to meet new people. Who knows, maybe you impress someone and they gave you a good letter and you match at the same program. Actually, a lot of the people who rotate with us, they interview with us at University of Nebraska, and they actually consider them almost equal into like internal candidates. So I think that makes a big difference when they know your face, when they know you, and they know the faculty have interacted with you. That makes a big difference. If possible, and if possible to do like 2 rotations, away rotations, that's the best case scenario. You can get letters and you most probably will get interviews from those places. And then research, I think a lot also depends on the quality of the research. So if you have like an abstract, an ASH or ASCO, and if you're like a first or second author on that, I think that's much more helpful than if you have many case reports or like studies that are published where you are like the last or second last author, and as compared to if you have like an ASH or ASCO abstract or like a single publication where you're in the first few authors. And also if you do submit any research you submit with your application, you can expect to be asked a lot of questions about what your role was and what were you thinking and what were the results, and they can ask a lot of questions about that during your interview.
Well, Amar, this is great. I know there are a couple of people who matched to Cleveland Clinic, so I want to hear from them as well. But before we go to them, can you answer this question? So let's assume somebody has done their internal medicine residency. They want to pursue a HEMONC fellowship. They are fixing their visa from H1 to green card or whatever. And they are in an academic job, hopefully week on, week off. So what can they do in the week off? I can tell you what I did. I was in a similar situation. I graduated, I was on H1 job. I went and met with the chief of oncology, and he sent me to the bone marrow director of the bone marrow services. And he said, Faiz, we need some help on the inpatient floor. So you can help us, round us, and work as a resident. I did not like the answer. I said, I have done 2 residencies. And then this guy's telling me work as a resident, but he was absolutely right, because I have not seen and get training on patients who have unique oncological challenges or going through stem cell transplant. So in my week off, I used to show up 7 a.m. and see a few patients, write few notes, attend the rounds, and stay there till evening. And the time came for the match, they actually matched me for next year, but one of the fellow did not show, and so they offered me to start a year early. So because they knew me, I was there, they liked me. So, these small things, you say, shadowing in a hospital, how can that help you? Yes, it did help me. So, Amar, any other suggestions?
Yeah, so I think you do actually get a lot of time when you have the week off. I used to work with some faculty in our oncology. I used to go to their clinic sometimes, help them out. I used to work on some research projects with the residents, especially kind of working with them, mentoring them. And so I actually probably did more work in HEMONC when I was a hospitalist rather than when I was a resident. So it goes on to show that if you keep on working, it actually builds up your CV. So, and actually, when I was interviewing a lot of the programs, especially community programs, they didn't really look down on it because they thought a couple of the faculty actually told me that a lot of our fellows are people who previously worked as hospitalists or actually did their waiver jobs. And they actually have more experience and we like them more. So I think it's not a drawback in that sense at all if you continue working on oncology and improving your CV. One thing I do want to caution about is I think now, like if you are on H1 and you start working as a hospitalist, the priority dates aren't current anymore. There's like a 18 to 24 months retrogression, which means for me, when I started as a hospitalist and they started my green card process right away, it took me 2 years to get it done. Now, if someone starts, it'll probably take closer to 3 if you are being optimistic, or 4 years. And then after, if you apply after that, it could be like 5 years before you start your fellowship. So it is taking longer now. So if someone is thinking about this route, they have to keep this in mind that it's not 2 years anymore. It could most likely be 4 years before you are able to apply.
Let's see if anybody who matched to Cleveland Clinic is here.
Yes, Dr. Anwar. This is me. Good evening, everybody. My name is Sindhu Vikash. I am third year resident at Jacobi Hospital, and I matched in Cleveland Clinic this year. I'm gonna be part of Cleveland from coming July. Happy to be here. Happy to answer all your questions for the people who are applying this year. For me, so as a Jacobi residents, we were not allowed to do any outside electives. But it's really good if your program is allowing you like to do any outside, rotations, clinical rotations. You can go in like bigger programs, let's say Cleveland Clinic or MGH or basically MD Anderson, or you can rotate there, do outside electives, get to know the people there, talk to the attendings there, make a connection. They will give you a good letter of recommendation. I think the letter of recommendation is really important because the more the attending know you, the more letter will be personalized and it'll be more stronger. So letter of recommendation is really important. Other than that, the research experience in my experience, it's like it's not about the number of the publications that you have. It's about basically what strong your publication is, how impactful your publication is. Like in my interviews, most of the people ask me like, tell me any of your most interesting research experience. They're not going to ask you like every single paper. They will ask you just choose one, any impactful paper, and you want to discuss with us if you have like any interesting findings or so. So I had a very interesting paper that I published in ASCO. It was accepted for poster presentation, and it was really interesting paper. And I think like in almost all interviews, I talked about that paper, and everybody really liked it. So it's about like how interesting your paper is and how you are presenting your findings and what did you learn from it. These are the most important things they will ask you in the interview. And just be yourself during the interview time. Do not stress yourself. Be honest. This is all they want. They just want to know you as a person. If you don't know anything, they will teach you there in hematology oncology. But how are you as a person is really important during the interviews.
Because number one, welcome again. We'll see you soon. Thank you for your talk. Let's see. I see Mohammed Faisal is here. Faisal. Who wants to go next?
I can go next, sir. I'm Rafi, one of the fellows at UMS. So I'm just gonna, so all the speakers that I mentioned, I'm gonna echo all of those things. I'm just gonna add a couple of points which I think, which I felt were important during my fellowship interviews, and I interviewed applicants last year in my program. So I think number one, which I want to mention is, since Karun mentioned that, ERA CV has changed quite a bit, over the past I think 2 years. And now instead of writing, your clinical experience, research experience separately, they're asking you to write meaningful experiences. So I think that part is important because you can write any experience which is meaningful, including teaching experience, research experience, and clinical experience. But I think it is very important how you write it. As Sadhbhai mentioned about the collaboration and all those things, which are really important, especially, and you can write it down in a way that catches the eye of all your interviewers. So writing your CV, in a way, making it more interesting is very important. The second thing is coming to publications. Abstracts, yes, they are very important. They add to the CV, but also if the interviewers see all the abstracts and they see like a very low or no full length manuscript, that sometimes can go against. So not against, but I said, that does not give a good impact, and that gives them an impression that you are not finishing the task. So once you have an abstract published, or as a poster or anywhere, try to get them to the full length manuscript. That speaks a lot about your commitment and your dedication towards the project, and that you are getting things done. So because the abstracts won't show up on PubMed. Sometimes I've seen my attendings, whenever they start the interview, they just write their name on PubMed and try to see how many PubMed index publications they have. So if they have 50 abstracts mentioned in their CV, and on the PubMed they only see 2, then they don't really like that. So all the abstracts that you publish, try to finish those papers, convert them into full-length manuscripts. It takes some time, but I think with proper dedication, and as Dr. Anwer mentioned, write few lines every day. So that all those things are also very important. And lastly, letter of recommendations, yes, but make sure that the writer of a letter of recommendation knows you very well. Make it very personalized, because people get very bored of reading all those generic letters. They don't really pay much attention to that. So if there's something which is mentioned which is very quite unique, that really catches their eye, and that can become a point of your interview, point of talk of your interview. And again, I think the other thing which I think I also want to mention is your personal statement. Write your personal statement way in advance. Get it reviewed by as many people as you can, because every time someone reads your personal statement, it will get improved. So your final product should be very well reviewed. Avoid any grammatical basic errors, and get over as many and go get as many eyes as you can, so that your personal statement can be very refined and very focused, so that it can also be impactful.
Well, this is great. Let's see, is Dr. Shahzad Raza here?
Yes, I am, Doctor. I'm
So
listening.
Dr. Raza, I have a question for you. Dr. Raza is a good colleague. He's an associate professor, worked with us as a malignant hematologist. Dr. Raza, can you tell us about what is a strong letter of recommendation, and why would you like a strong recommendation letter for a candidate?
Well, I can give you my personal experience because it hit me really hard when I was applying for my residency training. I had 18 interviews when I was applying for residency training. My main experience was in neuro-oncology. Initially, that's how I started my career. What happens that, even if you work with somebody and the third person who is looking in your CV, they really need to know who you are. And you're going to the unknown person who doesn't know you, whom you work with, what your program is, and how you're working there. So there's a kind of big challenge. So your letter of recommendation, number one, has to be personalized. American grads, those who are trained here, they know all these things, what is called philosophical English, what is called the personable English, how to write, how to phrase. I think the part of the problem is sometimes your mentors also need some coaching here, how to write the letters. So that is something comes from you. You are doing your hard work and you're going to the program. So your letter, you have to coach sometimes to your mentor that you need a strong letter because they think this is strong, but it's not actually the strong. So the number one, your letter should be very much personable, describe who by himself he is, number one, and what is in his capacity is working, introduce you, and give some examples that how you have worked with him and how it's been impacting and how you coach him and how you learn through this whole process. And then write about your qualities, like the quality, particularly we always like team player, getting along with the people. That is so important. And you can, when you write these publications, and a lot of colleagues here have shown that they have published quite a lot of papers. So you can see there is a teamwork. You are in a group of people you're working. So that actually tells that you are a team player. So that's very important. And then once you have these personable qualities, your clinical experience qualities, initial introduction, the last paragraphs are so important that there is statements like, have my strongest recommendation, I would have taken him to my program, something like that. That tells that your mentor is really want to hire you. It's not going to go negative. Oh, I already my one of my colleague wants to hire me from this program, why you're coming here? That's another question that during the interview been asked. So I think you really, but that statement is needed. You really need that strong finishing your statement, like a last few lines, because people weigh on that, like how your mentor actually feel about it. So those are the things that I really feel it's important. And we learned this thing because we got through this green card process through EB1 or EB2, whoever has been applying, that how you get green card through the research. And when the people review that those applications, they really like to review it. And think about this, that you are getting the Nobel Prize. I'm not saying you're going to get the Nobel Prize, but think about this, somebody is recommending you in a way that you are competing the Nobel Prize. How you write the letter, that you're not even close to that letter, but think about that. Now, when you start thinking it, you can see a lot can be written in your letter because you work so hard for those rotations. So I really think that you should coach your mentor who is writing and request them. And I think that many of them really open to this. You work hard, you show them what time you're coming, what time you're going, how much efforts you're putting it. It has its all value. And it has to be in the letter in a way that, somebody reads it and they impress with your personality. That's what I would say.
So Dr. Raza, do you suggest that once they send an email, ask for a letter, they try to highlight their strengths in, maybe some numbers or some bullet points that, I have worked with you. And so is it helpful to help the person who is writing the letter?
Yes, it can. But sometimes, some letter writers are very secretive. They really don't want you to involve in that. So that's you need to find out the art, how your mentor should know. And because that's a trust issue as well, because you really want to trust the mentor, you want to write it, but how strong they write the letter. I think if you have a good connection with your mentor, like for example, if I'm working with Dr. Anwar and if I ask him, I have a full trust. And you guys who work with him, you have a full trust. And I think it's very quickly you learn this thing. Like, you have trust on this mentor, he's going to write it. I think it's important, but it's the way, everybody has a different way of writing those letters of recommendation. I think it's case by case basis, but you really have to highlight your strength. My suggestion is whenever you rotate with someone and have an experience, write a very nice and detailed email to that mentor after your rotation, that how it is important for this rotation, what have you learned, how it is impactful for you, and you will be in touch in the future for all those projects. Because that email, after a few months, when the mentor is writing the email, your letter, it's going to pull up that email for you, and he will get the information. That is another way without pressurizing your mentor, and you can actually deliver your information. I think those are the things. I still feel it's for the colleagues letters, mentors letters, and even once you finish your fellowship training, that's going to help you a long way with your letters of recommendations.
Yeah, this is very helpful, Dr. Raza. I just want to add a few things here. Number one, when you write that email, try to write that email with the feedback, with the reflections, maybe every week. At the end of the week, if you work with somebody for 3 full days, at the end of the week, write reflections, what you learned, what you really enjoyed. And then at the end of the rotation, then you can highlight all those points. So that helps us when I'm writing the letter. If I look at your email and I see, oh, this person saw those 3 cases and they said they're going to write some focus review based on that, some image report based on that. That's one thing. The other thing is when we say mentor and the letter, in oncology, your patients are lifelong patients. Most of our patients, when we diagnose them, either you die or they die, the relationship does not end. And that's really the truth. When I moved from my previous job, and when Dr. Raza moved from previous job, he can tell you our hearts were broken. Patients were crying. Their families were crying. They were writing letters that because they have such a great trust in you as an oncologist, as a physician. And that is same true for an oncologist. So I have now written letters for people who went to medical school, went to residency, and went to fellowship. And then I have written letters for people who went to residency, fellowship, assistant professor, and associate professor. I yet have to write a letter for professor for my trainees, but soon that time is coming. So it's just and they rotated with me maybe 4 weeks. But 6 years later, 7 years later, we are still talking, we're still collaborating, we're still publishing, we're still writing letter for each other. I requested this year for 5 people to write a letter for my professor promotion. And they started working with 5-6 years ago. So it goes both ways. And so you really need to find a good mentor and then make sure that you don't leave that mentor and then continue to grow and continue to progress. Thank you.
Dr. Anwar, I have one thing to add, but that is not with the letter of recommendation. It's something for the fellowship training wise, like who wants to apply for fellowship training, and one lesson for advice for our already who has been selected for the match position. So, sometimes your program is not strong. You've been training and you figure it out. Your program has some weaknesses in hematology oncology, and let's see, I give you an example. You're applying for Johns Hopkins and you are in a small community program, but you have an excellent CV. You have done quite a lot of work. One thing we see the challenges in the situation like that when you apply, they ask you how big is your program was, like how good was the program, how you were rotating it. And think about that you are trying to compete for a clinical position. You're not trying to compete for a research position. Research is an extra sauce that you build up in your CV and it's a strong in your career success. So it's something is very, very helpful if you have strong letters and your CV from the research perspective. So, but still, it's a clinical job. So you really have to be really good in clinical training, and also you're good in the research training. So one of the things we see there is a challenge comes in these type of situations. I would suggest that in those cases, it's very helpful if you are in a small community program, you should try when you are a second year or third year, try to rotate somewhere else. Like it's very important what Sindhu has mentioned, like, you know, you go to other programs, like a little bit bigger programs, get an experience, how those experiences work. Now that's one scenario. The second scenario also come up when you are, let's say you graduated, you are an hospitalist, you are getting working. So you have to pick your job, like hospitalist position, where you want to work. That has to be in a program where oncology services, and you can do oncologist hospitalist, or you can cover the bone marrow transplant as an hospitalist. That actually helps a lot, rather than you're working just seeing internal medicine patients. So the clinical experience does count. I remember one of my junior student 3 years ago. She was at New York Community Hospital, and I was working as an assistant professor at Columbia University. So she comes overnight. She was doing the night float, and in the morning she wants to work with us. I know this is not correct, but she comes in, she rotating, and she got a very top class position because she find the way. Like if I work in a small program, I'm not gonna go anywhere else. I need something else with that. So she start from the clinical side. So that is important for those who are in a program which they think the matching into hemonc is it's not high possibility. But I think everything is possible. You have to build up your research CV portfolio, and on the clinical side you have so many options that you can do that. Match fellows, I think your journey has started now. This is the time that you really been competing it with a very competitive pool of people who will be, you will be a fellow, then you become an attending. You have to be really good in your clinical training. You need to be make sure about the patient care, the patient support, and then, you know, build up your research portfolio. Many times we see there is a pause sign after, once you are a fellow, now I'm done and I'm going to do my practice. That is okay for some people. But I think if you have an academic passion, go for it. Continue doing it, because this is a never ending journey, and you continue to grow, and you will have better satisfaction. In my opinion, you will get so much satisfaction if you continue to do your research and your activities, what you're already doing, because one success leads to another success. You don't know how many more challenges you will see in the future in terms of the success. So I think this is a great group. And Dr. Anwer, I am super impressed with your training colleagues, and I was not aware that you have such a great candidates who have been successful, and I really wish them all the best for the future, and I hope they will be great mentors for our juniors.
All right, so I want to hear, thank you so much. This was super helpful. I want to hear that if somebody is stuck in a medium-sized program, and I think Dr. Raza talked about that a little bit, they went into residency and it's a program where they don't have a strong HEMOC program. So how that resident keep on improving the portfolio? Can anyone tell that from their personal experience?
I can go, because when I did my medicine training, we didn't have a HEMONC fellowship program or a very strong HEMONC. We have like a community HEMONC clinic with Carmanos at that place. So what I did, as Dr. Shahzad mentioned, as Zara mentioned, I did away rotations to get hand, upfront first hand HEMONC experience. I did a couple of months in hospital where they have a strong HEMONC fellowship program. Kind of build connections, see those patients, expanded on the HEMONC experience. I think that added to my portfolio. Second thing is, keep in touch with publications, research. Because for research, you don't really have to be you don't need a lab. You don't need to go to a bigger center. If you can find a group that we have here, and you are actively contributing, you can get good publications, and get good research experience out of it. And I did get asked this question, as Dr. Shahzad mentioned, about when I was interviewing at Baylor about about my program, and I think what they really were asking is how strong clinically you are. You have good amount of research in your CV, but you also need to tell them, I'm strong clinically here, and I did this work alongside, despite the fact that I did not have a strong fellowship program at my training. I did this and that. So getting outside rotations, stay in touch, collaborate, build your research portfolio. So I think those are the things you can do even if you're in a small community program in your residency.
Great, thank you. Now, any of the existing fellow who have not spoken, this is your time.
Hi, I would actually like to add something. Everybody has given really good suggestions, and they have actually given all the important foundations for matching into HEMONC. But I want to add something which I realized after I actually did my interviews and matched. So I had applied broadly to all H1B offering programs across different tiers, and I realized one very important difference, especially when I was interviewing at higher tier programs like tier 1, 2. I realized that they wanted us to be very specific. Like they would ask very specific questions like, do you want a single board or double board? Do you want to be clinical investigator or have a lab-based career? Like, so detailed, which sometimes I was not prepared for. So that is something, if I could go back, I would actually advise you, especially if you're interviewing in that kind of, those kind of programs, to be prepared, like to have some kind of idea. If I know that it's not always possible to know. At this time, even I don't know what kind of academic career one would go with. But if you could connect your existing research or your projects with your future plans and weave a really good, story with your conveying your passions, that's going to be very helpful.
This was very good. Hiba, thank you for that. Let's see, anyone who has matched?
Dr. Anwer, sorry, I'm going to answer Hiba's this question about the academic track. A very good question, and I think there are some places where there is a 2-year oncology fellowship program, 2-year only hematology fellowship program. They want to board on one. I think you have to general consensus is 3-year program that many places have, and that's what we do. This is your defensive way you can go. I'm sure Hiba, you had CV like that you have done so much research or publications. So they're sometimes interested in, are you really want to focus on one particular area of the hematology? They sometimes are interested. You want to be a bone marrow transplant expert in the future, or you want to be just a hematologist, oncologist. Not every program does it. I think reading the website where you are applying, and that's very important, what you have mentioned in the personal statement. And if I'm correct, you can still have an option to write more than one personal statement sometimes, like when you're academic versus the community. This question is important for people who are applying for community programs and they have hematology oncology fellowships. Let's say you have experience in bone marrow transplant and you go to the community program where they offer you only 3 years of training with the journal hematology and oncology. And couple of fellows who do not match, and when we ask them what was the reason, and they come up with this thing that when the program say that you're not really a good fit for us because your ambition is to do bone marrow transplant program and we cannot offer you that particular service. So something people have to keep an eye. If they really want to apply, sure, but they should have a plan what they're going to do after 3 years. And if they can tell them, I think the program can still be convinced and hire them. That is something that people should know about the program's goals and objectives.
That's great. So the bottleneck is enter into the fellowship. You can always do a second fellowship. You can always do a bone marrow transplant fellowship or a lymphoma fellowship. or a junior GI faculty, and that could be a training process there. So I think you should try to not say no to a program just because you want to do a particular thing and they don't have that greatest CLL program where you want to pursue your career. That's okay. Finish your necessary HEMOC training, and then you can always do these extra trainings. So I think we are almost done. So anyone else want to make any comments? And this is, we are on a group. If you have more questions, you can always post the questions in the group and we all can try to address that. Now, I have a question. And my question is, how can we use this group, the fellowship group, more effectively? Who has done that? And if they want to comment about that.
So, Dr. Anwar, I can go because for the last few years, I'm working in this group along with multiple people. So everybody, when so many people join every year or every month, they're interested to publish more. And some people wants to learn how to publish, like do systematic review, meta-analysis, even case reports or simple reviews. So people are interested and you keep sharing some information and some ideas how to do it. But we need self-motivation also, like and follow the deadlines. Like if you try to help us, it's only on us if we want to help ourselves. If I'm dedicated to do like create a timeline for myself that at the end of this year, I'm gonna do at least 2 full papers or more than 2 abstracts and attend some conferences, that can be helpful for me. And then I can create a group of 5 people and work with them. But when like there is the lag where comes when we make groups and people doesn't follow, so then like everybody lose contact and they lose interest, and then the work stuck there. So that is, I think, one thing that we need some self-motivation for ourselves.
So I know Wajiha has been working with us before her residency. I know how many publications she has, but I want her to share that how much publications combine everything together, how much you have in your portfolio.
So thank you so much, Dr. Anwar. I don't want to say, but that's more than 70 publications for now. And we are, me and my husband, Asher, we both are, it's good for both of us that we both started with you together. And we are kind of keep motivating each other. And sometimes we stress each other out that you are not working enough. So this thing keeps us on our toes and we keep publishing. As Dr. Rafis said, that it should not be only abstracts. So we try to publish full length papers also. So we did like 20 or more than 20 PubMed index publications, but we keep trying to do more abstracts so that you can go to conferences, ASH, ESCO, SOHO. There are so many other conferences, like local conferences. We try to go to each conference and do more work on abstracts. That's more helpful for us.
Very good. Thank you so much. So someone who wants to say something can raise the hand electronically so that we can give them a task. Otherwise, we are done. The last time I did a similar session was done on Twitter. Salman actually we got it published in ESCO newspaper. So this could be a kind of something, a letter or a newspaper article for these. There are so many hematology oncology newspapers, so we can send it to them. So if someone has an interest, this can actually be published. Thank you. So I did not see any raised hand. Is that correct? Well, this was late in the evening, so thank you so much for everybody being here. And I sincerely want to thank you for your ambitions, for your talent, for your hard work, for your sacrifices, and for your dedication to serve with excellence, and for your knowledge. Thank you so much. Good night.
Thank you so much.
Good night.
Thank you, everybody.